IGNITE is the first pediatric hematology oncology health equity research consortium. And the genesis of this consortium comes from some very basic and stark data on disparities in childhood cancer. And so in childhood cancer, we as a community of investigators and clinicians have agreed for a long time to come together and do what we call collaborative research protocols, where we all agree on the research questions that need to be answered. And then together, we run those research protocols or clinical trials across many centers in the United States. And this has been highly successful in allowing us in pediatric oncology in particular to figure out whether drug A is better than drug B in improving cure rates for children with cancer. We have data now that tell us that just about 1 in 3 children with a new diagnosis of cancer lives in a low-income household, and 1 in 3 children with cancer lives in a household where their parent tells us that they are worried about putting enough food on the table, keeping the heat or electricity on, getting to medical appointments for chemotherapy. We also know that children who are exposed to poverty at the time of their cancer diagnosis are more likely to have their cancer relapse, and they are more likely to die from their disease. And these disparities don't only impact disease outcomes, such as relapse and survival, they also impact many other very important outcomes for our families, including things like parent psychological distress, including things like increasing unmet needs in the household. And so as clinicians and investigators who take care of children with cancer, an incredibly important question has arisen over the most recent years, which is how in the world do we figure out how to make sure that every child has an equal chance of cure and an equal chance of the best outcomes that we know how to offer with our current evidence base? The way that we run research protocols and clinical trials across the United States are all built around doing drug trials, and they are not, in fact, built to allow us to quickly answer questions about what we call supportive care interventions or things that are intended to address disparities. And IGNITE is our answer to that gap. It is a new infrastructure that is going to let us more rapidly do those studies.